Hello, hello. I'm Persia Nicole. You guys can check me out Monday through Friday, 10 a.m. to 3 p.m. Of course, on 92Q. You see my background. Today, it is all about disparities in maternal health and making sure we are all educated. And actually, have a special guest, a few special guests hanging out with me today. First things, I want to introduce Tonii Geddin, Health Officer for Arundel County Department of Health. Hey, Tonii.
Hi, Persia.
Can you tell me a little bit about what you do?
Yeah, as you mentioned, I'm the health officer for the Anne Arundel County Department of Health. And what that means is that in addition to leading a wonderful staff of almost 800 people here with the Department of Health, it's really understanding what the health of the county looks like, right? So, of the almost 600,000 residents in this county, what are the things that we can do to either directly address health, look at ways to partner with the community and other agencies to address health, and making sure that we are informing people on health risks, healthy behaviors, and just making sure that the public and the residents of Anne Arundel County understand what they can do to have their best health.
Absolutely. We actually have someone else joining us today that has been through things that you might have been through as you're watching us. Special another guest, Chanel Pierman. Where's she at? Hi.
Hi, thank you for having me.
Absolutely. As a local mom who will also share your story, a personal story to you. Why do you think it is important to even share your story and be on this platform so people are educated as well?
I think it is so important to share my story of my traumatic birthing experience as a Black mom because, first and foremost, I'm alive and here to share my story. And unfortunately, there are so many Black mothers who aren't here to share their stories. So the fact that I was able to survive my traumatic birthing experience and help to spread awareness about this very real crisis that's happening in this country, I have to do it.
Yeah. Did you even think about it before, like do any research to see if like this is common among other Black mothers? Or after you went through this, were you kind of like researching, like, wait a minute, like other Black moms need to know about this as well?
I have heard stories of it
Mm,
happening to other moms, but you never think something like that would happen to you.
yeah.
I never in a million years thought that what happened to me would happen. So when it did, and I started sharing my story and hearing so many other Black moms going through similar experiences, it's heartbreaking.
Yeah, and for one Black mama to another Black mama, you are so strong, and we commend you for what you went through. And we're so happy that you're here, able to share the story and educate so many other Black mothers. So thank you first for your time.
Thank you for having me.
Yeah, Tony, when it comes to Black maternal health, what are the factors that contribute to these disparities?
Yeah, it's really multifaceted when we think about things like provider bias, right? Of people treating folks differently because of what they look like or your underlying understanding of what people might be dealing with. But then also we have things like underlying health conditions. So we know that rates of diabetes and heart disease, high blood pressure are higher amongst Black residents. And so knowing that you go into pregnancy, which is already a dangerous health condition in itself, and then you have higher rates of those conditions playing into this as well. I think we're also looking at things like trust amongst providers, right? If you are not informed about what you can advocate for, if you feel uncomfortable with someone, if you're looking at, I need to keep elevating my concerns, do people feel empowered to do that? Do people know that, like, I don't like this provider, I think I'd like to see someone else? So I think trust amongst Black mothers with OB providers is something that we also have to work on, and attributes to people advocating for themselves or feeling like they can be honest about what they're experiencing and having that taken seriously and heard, as Chanel mentioned. And then we also look at things like what we consider social determinants of health, right? But what are all of the other things? Income levels, access to care. Are you close to a provider? Are you close to a provider that you'd like to see? And making sure that people have adequate access to the appropriate health care. And for some members of our community, that's not the case. And we want to make sure that folks know what they should be doing and how they can improve their health. And also, how do we work with the community? How do we work with providers to really change the outcomes that we're seeing, because the disparities and the health inequities are alarming.
Yeah. And I think the first big step, right, with Anne Arundel County is working with moms like Chanel, like, just really kind of getting the word out. And so people are able to understand, like, hey, like she went through this, I have a cousin who went through this, or my sister, like, there's a community and a hub to help other women also, tackle these issues and prevent these issues as well. And that's what it's all about as we're having this conversation. Chanel, can you talk about your story? I know, I'm sure it's might be a long conversation, even thinking about it in your head, but can you give us a sum exactly what you went through?
Yes, of course. Well, in 2019, I was pregnant with our first child, and the pregnancy, for the most part, was amazing. It was our first child, the first grandchild on both sides. We were just so thrilled to have our baby boy. And like I said, the pregnancy, for the most part, went well up until that last week. The last week of my pregnancy, I started experiencing some concerning symptoms. I became very swollen. I had gained a lot of weight in a short period of time. My blood pressure started rising, and I knew that something wasn't right. So I started expressing my concerns, and I feel as though I wasn't heard. Then 1 week after having my son, I unfortunately had a stroke and I almost died.
When it comes to Black maternal health, and really I think in our Black community as well, sometimes it's not enough education. And I'm always trying to push for more education in our culture, in our community, in the city of Baltimore and beyond, Anne Arundel County, Maryland, DC, just all of our surrounding areas, to make sure that we're way more educated. Anne Arundel County, at the Department of Health, you have a series of events all about education and helping us make sure we're a little bit more educated. We're going to actually pop something on the screen to talk about these events. While we are having this on the screen, can you give us some of what's going on, Tonii, all about the events?
Yeah, absolutely. So we're hosting a series of listening sessions where we are specifically looking to talk to Black mothers and their families, so support systems, because you don't go through this alone, right? As a person who's experienced an early birth of my twin daughters, I understand how many people had to support me through that. So we want to hear from whatever your support system looks like, because those people are also really important in helping you advocate for yourself or supporting you through the process. And so these sessions are for us to hear what the community thinks we should be doing to address these health inequities. And those health inequities include everything from preterm births to the rates of C-sections being higher for Black women, and infant deaths related to those things. And so we want to make sure that we are including the community in our planning process. We have a maternal and infant health task force for Anne Arundel County that we launched in November. And that task force is doing some planning. It includes a lot of different professionals, social workers, OBGYNs, nurses, really just wrapping around everyone who touches this issue, pediatricians, and understanding what we can do. But we can't do that without community voices. We need to know what people's experiences have been and what they would like to see us doing differently, and what sort of programs would be helpful to them and from their perspectives.
Yeah, absolutely. And Chanel, from going through what you went through, has it been any stories that you've heard after that you just maybe were shocked about, or just wondering why isn't more being done? Can you talk about that?
Yes. Unfortunately, with sharing my story after everything what happened to me and just sharing my story, I discovered that my situation is not unique. And that was heartbreaking to find that out, to find out that there's so many Black mothers all over who have also experienced traumatic birthing experiences and also have a story similar to mine. And like I said, that's just been so heartbreaking to find out it's a serious crisis that's happening. And it shouldn't happen. The fact that so many Black mothers are, instead of enjoying the happiest moments of their lives, they're fighting for their lives, or they're going through the most challenging times of their lives because of something like this.
Yeah, and Tonii, with all of the crisis, like you said, Chanel, how do you even begin to tackle this? Like we talked about a couple of different things, and of course, there are so many different events on the way from April all the way until May. What other things do you do to tackle these crises?
Yeah, and that's really where coming up with this task force was important for us, because as a health department, we are a piece of the puzzle. We're not the full solution, and we can't do it without all of the different providers, clinicians, and the community. And so coming up with this task force and creating a plan for Anne Arundel County as to how all of these different inputs and individuals can really help to tackle this this disparity, because it will take everyone's help to make this happen. And so having a group of folks come together to do some strategic planning, to look at the data, to understand where are the things that we can actually implement programs, and where are the places where maybe we need to be advocating for specific legislation or having conversations about funding. But understanding what the challenges are is going to be really important, so that we know that we're addressing the right things to actually impact Black mothers specifically.
Yeah. What has been some of the biggest challenges that you've heard thus far from other Black moms?
Yeah, I think we've heard people are scared, right? They understand the disparities going in, and knowing that choosing the right provider. How do you select one? Where should I go? How do I, figure out who's trusted, and if this is going to be a comfortable relationship for us? Understanding the different options for giving birth. What does that look like? And understanding really what's going on with your body during pregnancy, and what some of those complications could look like. To your point, Persia, of having education, when Janelle said she gained a lot of weight in a short amount of time, she was experiencing some extreme swelling. How do you know what those symptoms are? And so we've heard from folks that people don't always realize that they're potentially in trouble, and that they should be reaching out, or that because you're pregnant, everything that goes wrong is then heightened. And so understanding that you really need to take it seriously, have those conversations. And then if you aren't taken seriously, what do you do next, and where do you go? So we've definitely heard that from folks. And then just making sure that access is appropriate, that you can get out. I think for a lot of Black women, we've heard that I'd like a Black provider, or I'd like a provider that looks like me. And we're not always represented in the way that maybe you'd like to see, or that they're enough, or you can get in the right amount of time. And so making those decisions is really important. And we've heard those things from folks.
Do you have any resources that, fellow Black mothers can get to if they are looking for Black providers?
Yeah, that is a good question. And I don't know that I have that. I think what you'd really want to do is call in to wherever you plan to receive your OB care. And you can ask, right? When I'm calling to make appointments, if that is something that I'm looking for, you can say, I would like a Black woman, or I'd like a Black provider. And asking those questions to see if they're available. It's not unheard of. Also checking out websites, because oftentimes there are pictures and bios of the folks that are providing that care to you, that are available to folks if you're looking to find a new provider. But I'll make sure we get you something.
And I actually did that too, Tonii. I had changed my doctor's office, and I went on the website just to look at the different doctors they have there to see who could maybe and somewhat relate to me in some type of way, right? Because relation is the biggest thing for me, and I'm sure a lot of other Black women as well, because we want somebody who can relate to us in some type of way. You're going to be our doctor for the long road, or however long we're going to be there. So I definitely agree with that. Chanel, what would be some words of wisdom you would give to current Black moms, fellow, future Black moms? What would you say to them?
To be your own biggest advocate. I can't stress that enough. And even you have to be able to speak up for yourself. If you know that something isn't right, you have to speak up. And if you feel as though you're not being heard, or you're being dismissed, then you have to go find someone else that you do feel seen and heard from, and someone that is going to see you and see your concerns and handle it accordingly.
I love that. And also for those people who are just tuning in, can you talk about really quick, again, recap some of the symptoms that you had so that other people can know like what to look forward to as well?
Yes, I was very swollen towards the end of my pregnancy. I had gained a lot of weight in a short period of time. I had elevated blood pressure, which is something else I would stress for moms in general, but especially Black moms. If you can get your hands on a blood pressure cuff and be checking your blood pressure during your pregnancy and postpartum period, that is a huge indicator of issues that can be happening that you don't even realize is happening. I did that in my second pregnancy, and that was life-changing for me. But those were my symptoms, and they were concerning, but I feel as though I was not heard towards the end of my pregnancy.
And I think the biggest thing of all is making sure that you're heard, making sure that you're educated, making sure you have that support. And of course, Anne Arundel County has some phenomenal events on the way that you can get that education, some more questions. And, you know, it's all about disparities and maternal health. And as Black moms, and it's making sure we really are coming together. And I think events like this helps that. Where can we go for more information, Tonii?
Yeah, you can go to aahealth.org, which is the Anne Arundel County Health Department website. And on that website, we have all of the information about these sessions and also information about the disparities that we are seeing. So if you're interested in more data around this, we also have that sort of information on the website. If you go to aahealth.org /listen, you can actually register, and we appreciate you do not have to register to come to the sessions, but it definitely helps us to have a head count ahead of time. And we're going to be across the county in different locations. So we'll be in Severn, we'll be in Annapolis, we'll be in Brooklyn Park, and we're really excited to see and hear from people. And we know that for folks, this can also be a difficult conversation. This is important, but it can be triggering when you've experienced something traumatic. And then you, as Chanel mentioned, you get into a place where there's many more people, and that kind of realization that this is happening is important. So we will be paying special attention to caring for people's mental health during these sessions and making sure that people can share comfortably.
Well, I cannot wait to be a part of these events and have so many different people in our community in Anne Arundel County be a part of these events and our surrounding areas. Tonii, Chanel, thank you so much for attending this event and giving some good education. And Chanel, you know, much love and kudos to you as well and your family.
Thank you so much.
All right, ladies.
Black women are 3 times more likely to die from a pregnancy-related death than white women. I was almost one of them. When I was pregnant with my son, the warning signs were there, but I wasn't seen or heard. 1 week after having my son, I had a stroke.
Yes.
Let's empower Black mothers, promote health, and connect women to services that help build support. If you're pregnant, don't be afraid to make your voice heard. It will cost nothing, but could save everything.